As America erupts over the question of universal health care, we here at Houston PBS are combining our 2 Friday night local programs to bring you a full hour of discussion on health care. During our second half hour on Red, White, and Blue, David Jones and Gary Polland will explore the political side of this issue. But first up, how did we get to this point? What really are the needs of our current uninsured? And how can we truly provide health care for all Americans? I'm Ernie Manous, and this is Houston 8. Killing grandma, death panels, funding abortion. A great deal of conversation is happening in our country regarding health care reform. But what is the truth beneath all the chatter? Fact, the United States is the only industrialized developed country that does not have universal health care, leaving approximately 47 million Americans without medical insurance. In Texas, only about 12 million, or less than half the population, currently has health care insurance. The White House is proposing America's Affordable Health Choices Act, a government plan with the aim of providing affordable, quality health care for all Americans while reducing the growth in care spending. This bill would ensure that a certain set of benefits, decided upon by the government, would be covered. And so the battle begins. Is this the right move? Who decides what coverage should be granted? Who decides when coverage should stop? How much will all of this cost? What happens to the current providers? On and on and on. Most agree that our healthcare system is in need of reform. But how did we get to this point? What steps can we all agree upon to improve our healthcare system? And what does the future hold for medical care in these United States? Joining us tonight are James Hubbard, principal with Benefit Concepts, an insurance brokerage firm. Dr. H. Randolph Bailey, professor of surgery at the University of Texas Medical School and chief of colorectal surgery at Memorial Hermann Texas Medical Center. And David Lopez, president and CEO of the Harris County Hospital District. Gentlemen, thank you all for being here. It seems as though we have a monumental task ahead of us today, and that is to explain all of this away. And I guess the first point that sticks out to me time and time again is that we are the only industrialized, developed nation that does not have universal health care. That being a true starting point, how is that possible? I'll start with you, David.
Well, certainly there's a lot of issues that how we're different makes us very unique. We have outstanding quality in our country. Our costs are higher than what they should be, and the reform agenda should address the issue of cost, not the quality issues. But I think in this particular country, we've had a mindset that independent practitioners working with independent hospitals with government subsidies on certain programs is the way to go. Certainly there may be a lot of debate regarding whether that's the approach or not we ought to take, but we want to make sure that whatever reform we do, that we address the problems and not the symptoms.
Okay, but we've walked away from that very first question. I'll ask it again. I'll go down here. Is that the only industrialized nation that doesn't have this, which would lead me to believe that everybody else in the world thinks of the industrialized developed nations that it is a good idea. How could it be, and if I understand the ranking of our medical system, we're 37th in the world, how is it that we don't have it since we are America? I'm going to start with Dr. Bailey.
Well, I think one of the things that you have to look at is the issue of quality, just like Dr. Lopez just mentioned. You never hear of a patient leaving the United States to go to Canada or to go to Great Britain or to go to France or Germany to have their medical care. So I think that... I
don't know if that's 100% accurate. I'm sure we have heard everything on the news in the last few weeks, that people have come and gone and all this different stuff. And people talk about they can't afford health insurance in this company. They will go to Canada for a procedure. They will go to Mexico. So I have to question that point.
Okay, so my point was not about affordability, but about quality. No one would choose to go to Mexico for their medical care except on the basis of cost. Nobody would go to the Middle East or to the Asian Rim, Pacific Rim, without it being a matter of cost. So the quality is here. I think that the whole issue is the cost and the difficulty that everyone struggles with is aligning the two things, maintaining our quality. And I think that you gave the quote about the 37th in the
what
world.
Exactly is that?
And I think that is a reflection of a lot of different issues. Again, the uninsured who are probably waiting a long time before they have their medical procedures and their diagnostic procedures. We have a lot of people coming across the border from Mexico to have their babies in the United States, and they have no prenatal care, and they get here and they have all kinds of complications.
I'm assuming just from what you've said, the ire of some people out in our audience is coming up, because when they're saying people are coming here to have their babies, once again, who's paying for this? We're going to end up paying for this. Here we go into the cost being so out of control here. Jim, let me ask you this then. You hear all of this. Should we be 37th in the world, no matter how they're deciding it? Shouldn't we be number one?
Well, I think in a lot of areas we are number one. I think those rankings could be misleading. I will also submit to you that we do have universal care. We just don't have a single-payer system where everybody is covered. So the people that are not covered by our system currently, they receive their care for free in the emergency room.
I was just going to say, David, we do have, in a sense, universal care. If you get sick in this country, they are not just going to step aside and let you die, correct?
Absolutely. I mean, by law, if somebody shows up in our emergency rooms, we have to take care of them because of the federal, mandates, the laws that are there. I want to get back to the original point also. In health care, we've had the philosophical approach to health care that the free enterprise system should reign. There is some government involved with Medicare and Medicaid, but for the most part, in healthcare, we've had a philosophy in this country that the free enterprise system should prevail. That's why, in my opinion, we don't have universal or federal coverage for all areas. But ultimately, yes, as we have a need for individuals who have emergencies, we're there to take care of their needs, and certainly that's what we're supposed to do, but it is a very complex issue. And again, let me reemphasize, the issue here that we need to address is the cost issue, not the quality. I believe in quality we are number one in regards to what we provide. Our cost factors are what needs to be addressed.
Okay, we'll get to cost in a second. Dr. Bailey, you were nodding along there.
I agree that the quality is here, it's the cost that's the problem.
Okay, cost. We're going over to insurance.
That's right.
Jim?
Cost. It's 30 years ago, healthcare represented 1% of our country's GDP, and it was similar in other countries. Now it represents 23% of our GDP, and in other countries it's in the 15% range. So we are definitely above the rest of the world in terms of how much we spend on healthcare. But there's other components too that have led to the increase in cost. The one component that I think everybody's talking about is the medical inflation. Our technology is so much better than a lot of countries. Medical inflation in the last 20 years has outpaced regular inflation by 2 to 3%. But there are other factors too, like defensive medicine. Doctors are practicing defensive medicine, which some studies say costs.
Define that.
Defensive medicine is where, and there was a study done by the Massachusetts Medical Society a couple years ago, and they surveyed the doctors there, and 5 out of 6 doctors admitted to practicing defensive medicine and ordering extra tests, procedures, and referrals in fear of being sued. So defensive medicine is the excess tests that are ordered that are not necessary.
Well, we have a doctor.
And it estimates
Let me go over to
Okay.
Dr. Bailey on that point then. Defensive medicine.
I think it's clearly something that is largely practiced in the United States for fear of missing something, and not missing something that would be a legitimate thing, but missing something that you get sued for.
But as a doctor, take me through that process. If I'm a doctor, my patient is David here, and I've checked these different tests, and I've decided from what I know in my education and the tests that we've done that this is probably what ails him, then where does this next step come in? When am I no longer allowed to do my job as I see fit, and I have to start doing other work?
Well, you are allowed to do your job as you see fit, and basically that's the way I practice medicine. But I think that is, everybody has this little fear that something is lurking over their shoulder that's going to bite them. And as a result of that, nearly everyone that comes to the emergency room gets a CAT scan. A CAT scan is an hugely expensive procedure, carries with it radiation exposure and everything else, and the purpose of that is to make sure you don't miss something so that the patient doesn't come back.
But even if we have universal health care, wouldn't this still be going on? Isn't there still going to be the potential of these lawsuits? Isn't there still going to be worry that maybe you'll miss something and get sued?
You know, the problem in the United States is the magnitude of the medical liability problem. We have much more of an issue here than I believe in any other country. We have a large force of lawyers who do nothing but look for medical liability cases to bring forth and then defend. I mean, and prosecute. And then the other side of the thing is that there's an equal number of lawyers who are defending the doctors under those same circumstances. So even though the payout from medical liability is relatively small, the cost of doing all the tests that people are doing to try to avoid these things from happening, make themselves better prepared if they do have to go to court, and then the cost of paying for the lawyers to defend the cases is enormous. And I don't have any numbers on that.
Jim, I'm coming back to you in a second, so don't worry. Okay. But David, let me ask you this then. Even as I mentioned a moment ago, if we have this universal, we have reform in health care, how do we stop all of that from still going on? Can we, or is that going to be with us for the long haul?
There's no one simple answer for how to reduce the cost. Certainly that's a part of it. But from our perspective, what do we see? What's creating a health crisis in our country on a cost side are the things that are all preventable, in my opinion. We see individuals, if we could take care of these 4 items that I will mention, we could reduce greatly the cost of health care in our country. And the issue is drinking, smoking, drug abuse, and obesity. Those are all behavior modification related. If we could all, you don't have to drink, smoke, take drugs, or be obese. That's adding significant dollars to the cost of health care. So the issue that we're going to have to address is what is our personal responsibility for those elements of health care that we can try to deal with. We see a lot of our patients who are obese have problems with diabetes, hypertension, strokes, heart attacks, and all kinds of other issues. But the problem that we've got is what do we want in terms of a healthcare system? Secondly, what are we willing to do to afford it? Thirdly, if we could eliminate those 4 problems in our country, then we would not be under a healthcare crisis. So there's a lot of different things that we can do to lower the cost. Another alternative would be, for example, when a patient goes to a doctor and the doctor doesn't know what tests have been done, he will order a CT or an MRI, but if we could have transportable data so that the patient can carry with them all the CTs, all the MRIs that have ever been done on that patient, the doctor would not repeat some procedures. But right now, we don't have transportable data.
But isn't that happening? Isn't that something that's going on with these shared medical records and computerized medical records?
We're in the beginning phases of that, but that is not prevalent throughout the industry. Okay. But there's a lot of things that we can do. But certainly, as we're looking at ways to reduce cost, there's some things that we can do personally and as a system to try to address that. There's no one simple answer to address all the issues.
I want to go over to Jim on this and say, when we're talking about insuring people and people living healthier lifestyles, I have auto insurance. Mm-hmm. If I go so many years without having a wreck, my insurance goes down. I get rewarded for being a good driver. Mm-hmm. Is that out of the question in health insurance? Not
at all. In fact, a few years ago, the federal government passed some laws to incentivize people in that way through health savings accounts. So health savings accounts are still relatively new, but they incentivize people for not utilizing their plan. There's no first dollar coverage except for preventative care, so everything, including your doctor's visits and your pharmacies, go towards your deductible. And you decide what your deductible is based on how much you want to pay in premium, just like you do with your auto insurance and your homeowners. And so we get back to what insurance was 30 years ago, and it's more of a catastrophic type insurance. And you do get rewarded because the premium that you save every year goes into a tax-deductible account, and it's your money, and it rolls over every year, and if you never use it, you can roll it over into an IRA. So that system is already here. About 15% of the people are utilizing it, but it's something that it's a paradigm shift. I mean, when managed care first became prominent, that was a paradigm shift. I mean, people did not want to be told, you have to go to this doctor. But over time, they became accustomed to it because they were spoiled by the $10 copays. They go have a baby for $10. They can go have any procedure they want for $10, and it led to a lot of abuse in our industry. So there are plans out there that can accomplish that.
Dr. Bailey, I get the feeling you have something to say to this.
I was just going to say that the incentive, though, is not there for the vast majority of people, because most people's health care that have insurance are tied to their employer. And I think that's another one of the issues that clearly has to be dealt with. If you change jobs, your health care doesn't go with you. Your insurance doesn't go with you. If you move across state lines, for the most part, your insurance doesn't go with you. Particularly if you develop some type of illness, then you're tied to staying in the same job, because you can't change jobs and get insurance from another location. And this also, the fact that people are sort of getting their health care insurance as an employment benefit takes away the incentive to do the kinds of things that we're hearing about, to save money, to shop around, find some place that maybe it can be done more efficiently, and those kinds of issues. So I think that's why the medical savings plan, which is a wonderful idea, hasn't caught on any more than it has. I was surprised to find that the percentage was as high as he quoted.
Jim?
Well, I disagree with what he's saying about the employer-based system. I think it's the only way that we will not have the uninsured number go up from where it is today.
But isn't there a better way to do it? I mean, if I have great insurance because I'm an employee of the state of Texas, ultimately. Mm-hmm. But if I leave this job, what happens to my insurance? What happens to me? If there are layoffs and I lose my position here, what happens to my health care?
Well, you have COBRA for 18 months, and then if you have another job, then you have opportunities to get your care through that employer. But
and COBRA is costing how much a month?
COBRA is the employers can only add 2% of the cost. So whatever the actual cost is that the employer is paying for your premiums currently, they can add an additional 2%, or whoever is administering it. So it's whatever the cost is. Each employer pays a different cost for their health care based on their demographics and the type of plan and all that. So COBRA is not expensive. That's a very common misconception. COBRA is the actual cost of the premiums.
But if I have lost my job, anything is expensive to me at that point.
Right.
And then to keep my insurance going, and I only have 18 months, granted, God willing, anybody who loses their job will have another job in 18 months, but it gets harder and harder. Should that be connected there? I mean, some people can't afford it. You have a low-paying job, you lose your job. How can you afford COBRA and keep your rent and keep your food? So you have to give up something. COBRA seems the easy thing to give up, horrible as that sounds.
Well, the employer's subsidizing that, so it makes it more palatable when you are employed. But if you didn't have that system, the premiums would be just as high, if not higher.
Right.
And the reason is it's human nature. There's a lot of people out there that have insurance that would not have insurance if it was not either free or substantially subsidized by their employer. It's human nature. Right. They don't see the value in it. They think, well, I go to the doctor twice a year, go to the pharmacy twice a year, I spend $500 a year. Why should I pay, even if it's $20 a month? Why should I pay that? It's not worth it to me. And there's more people like that out there than you realize. And so tying it to the employer is the only way to get those people into the pool. If you don't tie it to the employer, then you're going to have a higher number of people that say, I'm going to take that risk. I don't need health insurance. And just, with auto insurance, it's illegal to drive without auto insurance, but still there's plenty of people without it. But with health insurance, there's no way to do that.
There are people in our audience right now that are watching this and saying, why is insurance even at this table discussing? Of course, we invited you there. Mm-hmm. But the point being that if it's medical, if it's us deciding what we're doing and how we're getting our health care, why does insurance have such a big voice in it? Shouldn't you folks come in after it all and say, okay, we're going to help pay for these things that doctors have deemed necessary, that this system has said this is what people need to live a fuller, healthier, complete life? Why is insurance so involved at this end?
Well, the insurance would be very agreeable to do that. I mean, they would set their premiums based on what they think they can make a reasonable profit. And that's what a lot of the politicians are demonizing my industry because they think it's too profitable. Well, the profit in most insurance companies is somewhere around 3 to 5%, which is well below what most other industries are. So the insurance companies would not disagree with setting the rules, however the government or the doctors or whoever says that they should be, but they would set their premiums accordingly. So when you start adding mandates, adding provisions that the insurance companies have to abide by, the premiums just go up.
Okay. David, we haven't heard from you in a while. How are you feeling about what we're discussing?
Well, yeah, actually, there's a lot of issues here. As I said earlier, there's no one single answer for how to address the problems. As we're looking at what we can do, obviously, as I mentioned before, better lifestyle is important. Part of the issue is that, I'll use our system as an example, 20% of my staff account for 80% of my expenses on health care. That tells me that if I can work on that 20% of my staff and make them healthier, that will help. Also, part of the concern that we've had is that we've got to look beyond just the insurance industry and the healthcare industry and the providers. As an example, a lot of the school districts have taken out PE out of the curriculum. And that has created a significant problem, in our case, with the Harris County Hospital District. Very recently, we had to start a clinic for kids under the age of 10 with fatty tissue in their liver. We never used to see that until people were in their 50s and 60s, but now we're seeing that in a lot of younger individuals, kids. So that tells us that we need to address the issue from a macro perspective, not just from the insurance provider perspective, but from what are we all doing in that regard.
Let me spin this conversation a little bit to where you're going and talk about that. We all have agreed that there are improvements that can be made to this system. I don't think I'm speaking out of school saying that. So where do we begin with something like this? We've got this system, and I in some ways I feel like you've got to tear it all down and start from scratch if you want to get to the ideal. But we're not going to do that. We've got to work with where we're at, and we want to improve it. So I want to hear from all of you ideas on how that can really be done, that we can improve coverage, that we can make sure nobody goes without medical coverage in this country, but that it's cost effective and all that. And I'm assuming your first place
Sure.
is be healthier.
Absolutely. Secondly, let's identify what it is we want. Let's identify, if we're going to talk about what we need to do differently, let's identify what we want first. Tell me what it is you want, and I'll be happy to provide a system that addresses those needs. But people will say to us, we want the very best possible health care, but then they add a little caveat, at the lowest possible price. Mm-hmm. And so the question I would have is, do we want the very highest quality, or do we want to look at the cost factors? Another issue we're going to have to address is, for example, in education, all children are entitled to 12 years of education, and it's free. Now, if you want to go beyond that point, then you've got to pay for it through a scholarship or through your own funds. Maybe we ought to look at health care along the same lines in terms of we ought to have basic services for all. Primary care is important. Prevention is important. Wellness is important. But maybe certain procedures and certain services, those are, we got to figure out a way to provide those through some other mechanism. But I think we're going to have to identify first and foremost, what do we want? And secondly, are we willing to accept whatever change that mandates that we accept?
Dr. Bailey, we want the best care at the lowest cost. Sorry, that's what we want.
And it's almost an oxymoron. It costs money to provide better care. But, you know, I think there are a lot of other issues here as well. Getting back to the insurance, the people who are looking for insurance coverage outside their employer get penalized doubly because their premiums are higher for the most part because they're not part of a risk-adjusted group plan. And then in addition, their premiums come out of after-tax dollars as opposed to before-tax dollars. And so we need to solve that issue as we move into this as well. The uninsured, though, there are several groups there that probably shouldn't be uninsured. 14 million, I think, of the 46 million that are quoted as being uninsured are people who are eligible for these federal plans, either Medicare or Medicaid, who just haven't gone to the trouble of signing up for it. There are issues with aliens that I don't want to get into at this point. And then there's also the working people who get back to some of this issue with insurance, that they make a decision that insurance is expensive and they're young and healthy, and even though they could afford it, they'd rather invest the money in their 401k.
Jim?
There's about 10 million that fit in that category that just choose not to have insurance. And that number would go up substantially if we did not have the employer-based system. I disagree.
But if we didn't have the employer-based system and we had a universal health care system, wouldn't that number actually go down?
If you forced everybody into it through
because
taxes,
I'm thinking, when I hear
you
this,
pay
too,
higher taxes like Canada, then?
Well, I'm saying if, and not to get into the taxing, and I know that seems silly not to talk about who's going to pay for this, but that can be a whole other discussion. But theoretically, if everybody is being taken care of and everybody is being insured, and the people you said that have chosen not to go are actually being insured, down the road, doesn't that save us more money in the end? Isn't it cheaper to handle someone's health in the early stages when they're younger and healthier and fit than waiting till the catastrophic things happen later on? True or false?
Potentially. I don't think that is ever going to happen in this country, though. But the only way to accomplish that is to have a system that's paid for through your taxes.
Let me also add, in that regard, our system that we have in healthcare right now, it is a system based on sickness rather than wellness. Providers, hospitals and doctors get paid when people are ill and get paid nothing when they're well. We need to convert our system from a sickness-oriented business into a wellness-oriented business.
And it's a great idea. Is it practical? Can it really be done?
If you identify primary care, prevention, and wellness as strategies, then I think you can do that. For example, outpatient care is very poorly reimbursed versus acute care. Acute care is better reimbursed than outpatient care. But the benefits that we get out of outpatient care, for example, in our system, we do about 43,000 admissions a year in our hospitals. But we do 1.4 million outpatient visits every year because ultimately that's how we stretch our dollars further by providing primary care, because that's $75 to $100 versus $2,500 a day in an acute care setting. So we've got to have a system that reimburses physicians and hospitals well for outpatient care, which is lower cost, and for keeping people healthy, versus right now the incentives are financially, you get better reimbursed for acute care and very poorly reimbursed for outpatient care.
I agree. I wanted to disagree with something that the doctor said about individual policies are not more expensive than group policies. They appear that way because the employer is subsidizing the policies that you get through work. The policies, in fact, are substantially less expensive on an individual basis.
But if I'm paying it out of my wallet, it's going to seem more.
Right, because it's not being subsidized.
Right. Doctor? I'm coming to you before we run out of time.
Back to the issue of preventive care. I think that everyone agrees that is a very, very desirable thing that we should work on. There are data, though, that show that preventive care doesn't necessarily save money. It costs money, but it ultimately results in better quality of life and better care for the patients. But I'm not even though it gets thrown around all the time as we're gonna get involved in preventive care and then we're gonna save all this money on the back end, and the data just don't show that, unfortunately. Everybody supports that concept, though.
So before we run out of time, in our last 45 seconds or so, I want to go through each of you. The best thing we can do, I think I already know what yours is going to be, but one more time.
And identify what we can do individually and collectively to try to improve our health status, for one. Secondly, try to look at the system we have right now and keep what's good about it and address the issue of cost, not quality.
Jim?
I agree with that, and I will also add that we need to get our medical liability system under control.
Yeah. And Dr. Bailey?
Maintain quality, cut cost, and do enough to the system to continue to attract the best and brightest people to go into medicine as a career.
Yes or no answer, are we going to see that in our lifetime?
I hope so, but I think, again, I used the word oxymoron.
Yes or no, and I'm out of time on that. So remember, there's still more to come on this topic, but first, remember to join us online at HoustonPBS.org. Simply click on the local program bar and pick Houston 8. Then you can read about our guests, learn more about this topic, and share your thoughts and ideas. Remember, information posted on our site may be used on air, so keep that in mind when submitting. But now the conversation continues as we switch gears and explore the political wrangling currently going on in this country with the president's health care proposal. Here are Gary Pollan and David Jones with Red, White, and Blue. Gentlemen, take it away.